So I think this is going to be a really interesting panel, an opportunity for you to hear from each of Alberta's four major parties. And I suspect you're going to hear some differences of opinion, some different ideas, different solutions. But I think this is one of those issues where it's something we're all concerned about. And obviously many of you here today have been directly impacted by it. So the way this is going to work, each of our four participants, our panelists, will have an opportunity to come up, and we've asked them to speak to sort of five themes that all kind of fall under this issue, to talk about the new cancer center in Calgary, access to treatment, access to health services, drug funding, diagnostic imaging. So they'll have an opportunity to speak to some of these issues, and we'll expand on more of that. We'll have a Q&A session afterward, and you've had an opportunity to write down some of your questions. So we'll collect those, and once they've all had a chance to speak here, we'll get them seated at the table and go through some questions. So looking forward to this part of the afternoon. So speaking first on behalf of the Alberta government and the Alberta New Democrats, we're pleased to have here today Brandy Payne, Alberta's Associate Minister of Health. Brandy is the MLA for Calgary-Acadia. Has been so since May of 2015. It was February of 2016. She was appointed Associate Minister of Health, has previously served as Deputy Chair of the Special Ethics and Accountability Committee, also a past member of the Standing Committee on Public Accounts and Families and Communities. Brandy Payne.
Thank you. It's a real pleasure to be here with you today. So for my first bit, you're going to get to hear from me twice, sorry, I guess. My first bit is going to be for bringing greetings, and then talking after, when we get settled for the panel, I'll get more into some of the topics that we're just kind of we've received the overview for. So I think first and most importantly, it is just such a pleasure to join all of you here today at the Tsuut'ina Nation and on the lands of the signatories of Treaty 7. And I'd also like to take a moment to acknowledge the Métis people of Alberta, who share a very deep connection with this land. It is a real honor to be here and to bring greetings and to share some of our government's plan for healthcare and for particularly prostate cancer. Our government, as you know, we were elected in 2015, and we've had a real commitment to ensuring that healthcare is available to all Albertans when and where they need it. You may have heard my sister minister, the Honourable Sarah Hoffman, Health Minister, speak about how it's important to have the right care available at the right time, in the right place, by the right provider. And that really underpins so much of the work that our government is doing around healthcare. It's so important that people have access to preventative technologies, to have access to early screening and diagnosis, and when required, that access to treatment. And I will talk much more about all of that when we get to my remarks, but I did just want to begin by extending greetings and well wishes from Premier Rachel Notley, from Health Minister Sarah Hoffman, and from all of my government colleagues. And I'm deeply looking forward to our question and answer period in a little while. Thank you.
All right, thank you, Brandy. Next, we'll invite to the stage David Kahn, who represents the Alberta Liberal Party. Of course, is leader of the Alberta Liberal Party, is elected as leader almost a year ago, June of 2017. David is from right here in Calgary, studied international and European human rights and constitutional law, is currently a lawyer as well, practicing in the field of Indigenous rights and land claims. He's worked with several NGOs as well. David Kahn.
Yeah, I'm really proud to be here. Thanks very much for having me. I'm the not so new leader now of the Alberta Liberal Party. I was elected in June 2017, and very excited to get more involved in politics. And I'm really happy to be here. I just want to say I'm very excited for this event, and as Ms. Payne has recognized as well, I want to take a moment to acknowledge that we're on Treaty 7 land. My day job is I practice as an Indigenous law lawyer, so this is very important to me. Awareness, understanding, and a cooperation in our communities and to recognize that here in South Central Alberta, we're on the traditional territories of the Blackfoot Confederacy, the Stoney Nakoda Nations of Chiniki, Wesley, and Bearspaw, and our hosts here are the Tsuut'ina Nation, and also more recently the Métis have their home here. So your presence here is clearly expresses your interest and commitment to healthcare in Alberta, specifically cancer care, and its prevention, detection, and treatment. And that applies to all types of cancers for all ages of Albertans, and so that all of us and our loved ones can and may enjoy a healthy and fulfilling life. As leader of the Alberta Liberal Party, my priority is a publicly funded universal healthcare system. You have my pledge that we will oppose any political initiatives that would reduce funding or cut this essential service. Albertans deserve affordable, quality health care, and Alberta Liberals will promise to deliver that. So cancer will affect 1 in 2 Albertans in their lifetimes, and this means that every family is affected. We all have family members. My grandmother died of cancer, I remember in the 80s when there was a lot less treatment options. So those cancer patients in southern Alberta will soon have a world-class healthcare facility here in Calgary, an academic center that will have be a world-class provider of cancer services. So I'm very happy that we finally got on the road to building that. When it opens in 2023, the Calgary Cancer Center of the Foothills Hospital site will significantly increase cancer care capacity by consolidating and expanding existing services to support integrated and comprehensive cancer care. And this facility was needlessly delayed by partisan politics in years past and should have really been in place years ago. The Alberta Liberal Party will put pressure on this government to ensure that there are no further delays or reduction in funding for this facility, much needed in Calgary and southern Alberta. More specifically to the reason that we're here today, 1 in 7 men will be diagnosed with prostate cancer in his lifetime, and it is the leading men's cancer in Alberta. Yet, if detected and treated early, there's a 95% survival rate. But still, more has to be done to improve services for prostate cancer patients and their caregivers, ultimately improve outcomes. That may include raising awareness, as we're doing here today, and what many organizations do, like Movember. Increasing availability of PSA testing, adopting advanced treatment protocols of surgery and drugs. We want our husbands, our uncles, brothers and sons to live longer, happier and healthy lives. And I recently reconnected with a colleague from law school who is a few years younger than me, so he would have been in his late 30s when he became sick with or was diagnosed with prostate cancer, and happily he's on the road to recovery. But it really brought home to me how it can hit men really of all ages, and especially younger men too. So we have to be not so cavalier with our understanding, and so that was really personally, as I said, brought home to me how important it is, and how important awareness is, and things like Movember and the mobile man van for testing. So so further to that, improving screening and preventative medicine is really important. With most cancer incidents related to aging, the health system must improve its ability to track individuals and populations to ensure evidence-based screening and appropriate times is available and offered. And Alberta Liberals believe that the government's role is to establish and coordinate the public and private parts of the healthcare system in relation to standards of education, treatment, and follow-up, and to provide optimal outcomes for the population. We support increasing opportunities and improving effectiveness in testing with some conditions. Women over 50, we know, can benefit from mammograms, and that's been well established over the years. And we're knowing more that more recently that men over 40 may benefit from rectal exam and PSA tests. Though I do want to note, and our MLA David Swan, a former leader, is a doctor, so I've relied on a lot of his advice to inform mine, but we have to remember that recommendations are changing as we learn more about the risks and benefits of prostate screening. You want to be asking these questions of your doctor, although last night at the social networking event here at the hotel, I learned that there are still many doctors that don't support early testing. So it's an evolving thing, and there may be, and your doctor may not actually even have the most up-to-date information. So encourage you to learn more about that. We know that every day there's more causes and treatments, better treatments, but many people still remain unaware about the prevention and early detection in order to reduce the incidence and improve survival. And as previous speakers have mentioned, lifestyle, including stress management, diet, exercise, avoiding alcohol and tobacco, are important to improve your outcomes. Getting back to where the government can provide solutions or address the issue, we know that delays in diagnosis and treatment contribute to preventable suffering and deaths. So consistent data management and collaboration between the various medical, surgical, and non-medical caregivers is essential. And we saw in the doctor who presented before lunch that there's lots of new initiatives in tracking and research and using that data to better understand the patient populations and what's going on with this disease. We also there's a real government role, obviously, in improving wait times and diagnostic imaging. We want better data management to essentially track cancers in the population and what screening and treatments are in improving outcomes. We have to remember that overuse of imaging and other testing bogs down the system with unnecessary specialist referrals and more testing that can complicate issues and add to wait times. But Alberta Health and AHS have critical roles, obviously, in coordinating and ensuring proper testing across the population of Albertans, and ensuring that guidelines are up to date and improving access to essential drugs among institutions, practitioners, and complementary programs. More generally, in our healthcare system, seniors are too often stuck in hospital beds when they should be getting community treatment, and we want to enable that patients stay as long as they can in the community, and so that's why we support home care and long-term care beds that can take the pressure off our hospitals and emergency rooms. Similarly, those with cancers in the community need conscientious and consistent follow-up and supports to avoid visits to the ER and delays to diagnosing complications. And I again learned last night about programs in the community like the yoga programs that are offered to cancer patients and survivors here in Calgary. So that's the kind of community supports and the supports that Prostate has with their monthly meetings with cancer survivors and cancer patients. So we want to make sure that there's that community component too that's so important. We can't just rely on our healthcare system. So I think government must move more quickly to provide new and more effective treatments that have been approved federally, such as cell-targeted therapies to improve quality of life and extend life where possible. We've talked about immunotherapies is a new cutting-edge area of treatment. And there's other new opportunities are emerging, such as internet-based education, consultations, telehealth, where doctors consult at distances to rural communities, home-based testing kits, and self-monitored pain management. But fundamentally, healthcare is a fundamental human right. And Liberals have a long and established history of not only supporting comprehensive healthcare, but of creating a Canada-wide system that we all benefit from and depend on today. I'll just harken back a little bit to the history of our country. In 1957, it was Liberal Prime Minister Louis St. Laurent and his government who implemented the National Public Health Care. And then 9 years later, Liberal Prime Minister Lester B. Pearson expanded that government policy to universal health care with the Medical Care Act of 1966. But there's still further that we can do. Back here in Alberta, the Alberta Liberal Party, we're committed to moving forward in conjunction with the federal government, exploring a way to implement a more universal provision of pharmacare to the population. We know that Medicare revolutionized healthcare for Canadians, but drug coverage was never implemented comprehensively. And I understand that all other G7 countries other than the United States have some sort of a comprehensive pharmacare system. We know more and more that people that lack the means to pay for their medications can cause their diseases to exacerbate, and then they end up in the ER system and costing us more money in the long run. So even for financial and reasons of our health budget, we want to explore ways to ensure that all Canadians can access the life-saving medications that they have. But I know that there's different ways of implementing this in working with the private system or a completely universal, comprehensive government-funded system. But we're committed as Alberta Liberals to be looking into this, and we know that it's got to be in partnership with the federal government. And the federal government is also looking into this. Another thing I want to just touch on is dental care. I used to, in a past life, was a pharmaceutical sales rep in the dental industry. So I know that dental health is really critical to our long-term health, and we know more and more how important that is. So, Alberta Liberals, we've passed a policy to examine dental health care provision for the population. And one place we could look at starting is ensuring that everyone under 25 has access to affordable dental care, because especially when you're younger, your dental health is very important to your long-term health outcomes. So I'm proud, as an Alberta Liberal, to carry on this tradition and to stand steadfast in support of these policies for healthcare for all. Alberta is facing tough economic times, but we will not pander to conservative fear-mongering and service cuts. Alberta Liberals will never sacrifice universal health care. I pledge that to you. And we will always maintain the highest quality health care for each and every Albertan, and we're committed to exploring more and better ways and more efficient ways to ensure that every Albertan has quality health care. So thanks very much for having me again, and I look forward to taking your questions and comments in our interactive session. Thanks very much.
All right, thank you, David. Moving on behalf of the Alberta Party, we're going to welcome to the stage Greg Clark, who's been the MLA for Calgary Elbow since May of 2015, serves on the Standing Committee on the Alberta Heritage Savings Trust Fund and the Standing Committee on Alberta's Economic Future. He has an extensive business background in technology and tech consulting, also very active as a volunteer in the community. Please welcome to the stage Greg Clark.
Brandy, good to see you. David, how are you? Good to see you. Hello, everyone. Thank you for being here. That's just going to have to stay right there. All right. Yes, exactly. So, well, thank you very much. And it really is an honor. We often begin these with an acknowledgement on the land, and we'll do the same thing. And it's a little different today, being not just on Treaty 7 territory, but actually being on Tsuut'ina lands. And it's a great honor to be here with each and every one of you. I will try to be somewhat mercifully brief. I was told that the sessions this morning were highly technical and that you learned a great deal. I think that with the politicians up here, I'm afraid we're probably going to bring the average back down to about normal where it is. But on behalf of the Alberta Party, on behalf of our leader, Stephen Mandel, I am very, very pleased to be here and to talk with you. I'm going to start my comments just some general framing that the Alberta Party strongly believes in Alberta's public health care system. We are truly privileged and blessed to have such remarkable people who work in the system, in all different aspects of the system. And that absolutely includes the folks on the front lines who provide that care, the amazing professionalism and compassion that we see from people in cancer care, in home care, in all aspects of our system. And that includes the people who do the work in the kind of behind the scenes, I guess, kind of back of house work, the folks who do the coordinating and the policy work and the organizing and the planning. They don't often get, I think, the kudos and credit they deserve for the work that goes into what, to those of us who are on the receiving end of healthcare, see as top-notch, world-class service. To make that happen, a tremendous amount of work goes in, a tremendous amount of research is done, and we really are privileged and lucky in this province to have such remarkable people. Without question, there's some work to be done. within our overall healthcare system, a system that consumes nearly 50% of the budget. We need to always be mindful of trying to find those efficiencies, trying to find ways of delivering that service at a similar or higher quality, but to do so in a way that's fiscally responsible and sustainable over the long term. And my short answer to that question is making sure we're truly listening to the people in the system. And I'm going to, as I go, come up talk to you about a few specific examples of where I think that we can go to address some of those challenges, but to make sure that we are in fact getting the most value out of the system and out of the money that we spend in healthcare, and that value is measured not just in financial return, but is measured in wellness, in great patient outcomes and health outcomes for people who all of us ultimately will interact with the healthcare system at some point. So I'll start with the question about the new cancer center, and without doubt, really looking forward to seeing that new center open. I'll address an elephant in the room if anybody wants to mention elephants in rooms. You may remember that our current leader was the health minister going back a couple of years, and there was some discussion as to where exactly the cancer center would be located. Stephen and I have talked. He's absolutely supportive of the cancer center where it is on the Foothills site, something I certainly advocated for during the last election, and we're thrilled and proud to say that we absolutely support the Calgary Cancer Center at the Foothills site. It's absolutely the right place. And one of the reasons that it is the right place is the current Tom Baker Cancer Center, for all the tremendous people who work there, it's a very crowded space. I don't think I need to tell you that. And getting the timely care that you need. I understand that there can be some real time-boxed consultations where people are moving through maybe quicker than you might like, maybe quicker than your caregivers might like. So it's an opportunity for more integrated models of care, where the service can be really truly wrapped around the needs of the patient, the needs of the family, the needs of the individual, and not constrained. So we're going to have a lot more space. The motto of the Cancer Center is building hope. And I think that's something that we talked about with the Cancer Survivors Network when they visited with those of us in the legislature earlier this week. It was a very enlightening conversation. But that means that in the Cancer Center we're going to have space for treatment, but we'll also have space for rehabilitation, for whole person care, space for research. And these are things that, if to the degree they exist now, are constrained. And so we're building a modern 21st century facility that's really going to hopefully be a beacon of what healthcare can and should be in this province. And we can do what Albertans do best, and that's lead. That we... the one nice thing about being in opposition is that you get to kind of nudge the government every now and then. And one of the areas I think that the Cancer Center really truly should be is it should be a community hub. It should be an opportunity to have space to co-locate community resources, home care type resources, with oncology resources, break down those silos. Our healthcare system can be very siloed. Government, I've discovered, is a tremendously siloed place. Try to marry together different departments, even let alone within the same ministry. That's a particular challenge. So I would really encourage, as this moves forward, to use it as an opportunity to break down silos. So as the Cancer Center moves along and we move into that building, we'll be able to free up some space for other services. And I would really hope that the space that gets freed up is allocated towards wellness in the broadest possible sense. Mental health funding in particular, I think is incredibly important, and something that we look at as a more of a preventative than a reactive. And our healthcare system, for all of its benefit and all of its strengths, is in many, many ways an acute care system. In many ways, we have a sickness care system. We don't necessarily have a health care system. So there's movement in that direction. I'd like to see a lot more movement towards prevention, towards wellness. The question about drug funding is an interesting problem. First and foremost, we need to make sure that people get the treatment they need to get better. to enhance and improve their quality of life. But at the risk of putting out I guess a perspective that may not always be the easiest thing to hear, I think we have to ask if a certain treatment, irrespective of cost, only adds a relatively short time to one's life, it's a fair question to ask if how exactly one would want to spend those next weeks or months, if that's the situation that we find ourselves in. And those are very, very difficult things for governments to grapple with, and I know that's something that we always need to work with the professionals who can help us make those proper decisions around drug funding. It would be very easy. One of the other things I've learned about being in opposition, and maybe I shouldn't talk this way, but what the heck. You don't have to be right every day being in opposition. All our job is to do is ask questions. So it would actually be very easy for me to stand up here and say we should fund every drug all the time to its fullest extent. But I'm not sure that's responsible, because I'm not sure that should we find ourselves in government after the next election or at some point, that's a promise I could actually carry through on. I do think that we need to make sure that people are getting the care that they need, whether that's pharmaceutical care or other care, and that's done in a way that's patient-focused and open. But that doesn't always mean that we're able to afford to spend absolutely every single dollar to pay for every single treatment all the time. We can focus on things like home care. We can focus on things like seniors care. We are talking about the allocation of scarce resources. Those resources are not infinite, and so we at some point need to make some choices and some decisions. So in terms of addressing wait times and talking about diagnostic imaging, and we're talking again about the allocation of scarce resources. The one thing I want to talk about in terms of an aging population, which is the other area we've been asked to talk about here. I'm really tired of hearing about seniors only in the negative sense. So you'll never hear me talk about bed blockers in hospital. You'll never hear me talk about the gray tsunami and all this crisis coming from the seniors. First off, people who are of a certain age have contributed a tremendous amount to this province and continue to do so. Continue to be caregivers for spouses and family, continue to contribute to this community in many ways. I mean, in fact, I was outdoor knocking in my constituency the other day. The mom of a good friend of mine is entering her 80s, and she continues to teach English as a second language. Part-time, but she continues to do that 2 or 3 days a week. And volunteerism and the contributions seniors have made to this province and continue to make, I think, is something that we should absolutely celebrate. So I think we shouldn't fear the aging population. We should celebrate it. Now, as it relates to diagnostic imaging, you may have heard of the Choosing Wisely campaign. It's a series of guidelines for physicians to help determine, if every instance of back pain needs a CT scan. It's also focused on education of the public, that when you ask for a certain treatment, your doctor may not necessarily give it to you because that may not necessarily be the thing that you need. And that is something that will also ensure that, of course, you get good health outcomes, but that the public healthcare system that we value so much is and remains sustainable. Technology, the opportunity to do remote consultation, what I think of as the Skype kind of model, which I know is much more high-tech and much more secure than your average Skype call. That also allows us to provide the kind of services that people want where they live, and that's especially important for people in rural areas. The disconnect, the difference in quality of healthcare between large urban centres like Calgary and rural Alberta is striking, and that's something that we need to look for opportunities to address. So screening and preventative programs, this is something that the government and the healthcare system itself does better than any of us can do, and that's public health, thinking broadly. Understand there's a doctor named Dr. Christine Friedenreich who's identified the lifestyle factors that are having an impact on longevity in Alberta. We need to invest in an end to smoking. We need to invest in identifying and mitigating radon. We all need to exercise more, myself especially. But that talks, that then lurks into things like design of our cities. It goes into things like bike lanes and transit and walkable communities. These are all public health questions that are going to help keep us healthier longer. In terms of accessibility to healthcare, one area that's overlooked is those conversations that we need to have with our families. Something called advanced care planning. If you haven't been to conversationsmatter.ca, if you haven't got actually meant to stop by my office and pick up some green sleeves, you don't know what that is, ask your doctor about it next time you talk to a healthcare professional. If perhaps they have some here. And full disclosure, my wife works in the area of advanced care planning, so I should probably say that. But it is about those conversations that you have with your loved ones that if you cannot speak for yourself, that they'll make sure that your wishes are carried forward, whatever those wishes are when you're dealing with the healthcare system. So again, conversationsmatter.ca. Finally, I'll just end on, and I think I said I was going to be brief, but here I am. So I apologize. It's an occupational hazard when you invite politicians up. I'm afraid they tend to speak. So, but this is an area. The question that we're asked is what can the provincial government do to make existing programs more accessible? And tell you a bit of a story. I was told about, so this is that silo problem that we have in government, and especially in healthcare. So there was an area that was looking for 2 nurse practitioners. And they said, the thing that we need here to enhance patient care, we need a couple of nurse practitioners. So they went and they applied to the nurse practitioner funding envelope. And they were said, sorry, nope, you can't have any money for nurse practitioners. And then over here, the same group went and they asked for a doctor. Can we have a doctor funded? Okay, you can have a doctor funded. And that doctor cost, amazingly enough, about the same as 2 nurse practitioners. But that isn't actually what they really needed. But now they're sitting here with this doctor they're perfectly happy to have. But they're in this weird situation where they actually they're now trying to figure out how best to use that doctor's time. What we should be doing is we should be looking at this group of people at a higher level and say, you have a set of expertise, you have a job to do, and you have a detailed perspective on how best to do that job. Here's a funding allotment of a certain amount of money. Why don't you spend it the way you think is best? Let's have much more local control of the people who actually know how to deliver the services and what services are needed on the ground. And I know, Brandy, I acknowledge that's a challenging thing in a $20 billion healthcare system. I absolutely acknowledge that. But I would look for opportunities to break down those silos. And the last example I would use is not a specific healthcare example, but the Sheldon Kennedy Child Advocacy Center. I'm familiar you are with that. Sheldon Kennedy should be put up on a pedestal and celebrated for all of the things he does big and small for this province and this country. He's a remarkable guy. But there was a tremendous problem with childhood sexual abuse. And those children would be brought into the justice system and they would have to tell their story multiple times to the police, to the prosecution, to the defense lawyer. And it was a terrible trauma for those children. Terrible. They have to relive this awful thing. And there was a very, very high rate of the perpetrators being let go because the story, a 7-year-old child, say, would change through the justice system. Sheldon Kennedy brought together, I think it's 11 or so different groups. There's childhood mental health, there's the prosecution, there's the police, a couple of different police agencies, there's the defense, there's prosecution. When something terrible like this happens, they're brought over to a very child-friendly space near the Children's Hospital. That child tells their story once. It's videotaped and it's allowed to be used through the court process. And that child is now in a system of care that helps them deal with that terrible trauma that they have experienced. And we're getting far higher levels of guilty pleas from perpetrators of people being found guilty and thrown in jail for the terrible things that they've done. And the outcome for those children is far better. And the system decided, we're not here for the interest of the system. We're here for the interest of those children. And so they changed to wrap around the child. It was not easy, but it can be done. And so that would be my closing comment before we get into the Q&A, is we need to think differently about how we deliver services if we want our services to be sustainable and higher quality. Thank you very much.
All right, thank you, Greg. Now, speaking on behalf of the United Conservative Party, Alberta's official opposition, Tany Yao, who is the MLA for Fort McMurray Wood Buffalo. That's been his home since 1977. He's been the MLA since May of 2015. Is currently a member of the Standing Committee on Families and Communities. Also happens to be the official opposition's shadow minister for health. He, prior to politics, spent 20 years in emergency response services and has spent a lot of time with nonprofits and charity organizations. Ladies and gentlemen, please welcome to the stage Tany Yao.
Good afternoon, honored guests, dignitaries, friends. It is an honor to be here on behalf of Her Majesty's loyal opposition, United Conservative Party. Cancer is a very serious issue, and I want to thank the Prostate Calgary as well as the Prostate Cancer Canada Network of Calgary. Great thanks in organizing this event and bringing awareness to this very serious issue. This very serious issue that does affect half of our population, or at least half of our population is at risk. And on the other half of things, we have issues that affect the other half of the population, like ovarian, uterine, and breast cancers. So I guess in the scheme of things, we do have to be very aware about a lot of these disease processes and bring awareness to that. And let's give them a big hand for doing such. Thank you so much. Health is a nonpartisan issue in my mind, and we all are working within the same system, and we certainly just want to see that system perform better. The only differences you'll probably see between us is just how the organization is managed from behind the scenes, but recognize that I believe that everybody truly believes in our frontline services and our desire to support that. When it comes to things like prostate cancer and so many other issues, we have to take a look at the opportunity that this provides us as Albertans and Canadians, because what we do have is the awareness, more awareness than so many other cultures and societies across the world. Secondly, we have a great base from which to do things like research and development. So when we look at things like diversification of our economy, one thing that we should be considering and looking at is our healthcare fields, and it is research and development. Canada does not do nearly enough in these areas. A single pharmaceutical company in the United States will invest more in research and development than all of our provinces combined. We have great educational institutions that can bring that workforce, and the workforce that we do currently have is at the top of their field. We have the most highly educated health professionals across the province and across our nation, so that when we are doing that research and development, it does not matter where you are in Canada, the healthcare professionals can help participate in that. So that's certainly one thing we'd like to see moving forward is research and development in things like this cancer. And so thank you again to the organizers of this. I look forward to our questions or your questions, and I thank you for this opportunity. Thank you very much, and God bless.
All right, so just before we get to the Q&A session, I want to invite Associate Health Minister Brandy Payne back up to deliver her remarks, and then we'll get to your questions afterward.
Thank you. Usually I go first, so this is the first time I've been making notes during someone's, all the things I would want to say about what they've said. But before I do that, I want to just take a moment to acknowledge Chris and his song that kicked off this afternoon panels. He was telling me at the break that he's also written one called the Alberta Pipeline Blues. So I'm looking forward to getting my hands on a copy of that to share with the Premier, because I feel like all of us in government these days are suffering a bit from the Alberta Pipeline Blues. So as Associate Minister of Health, the health and well-being of Albertans is my top priority. And cancer prevention and care is a critical focus of that work. 1 in 7 men will be diagnosed with prostate cancer in their lifetime. And although prostate cancer mortality has been declining since 2001, the latest annual statistics in the 2017 report on cancer statistics in Alberta indicate that an estimated 2,400 men were expected to be diagnosed with the disease last year. And I know many of the people in this room share a personal connection with this disease, and I want to tell you that I do as well. My paternal grandfather had been diagnosed with prostate cancer many years ago. Thankfully, he recovered from that, but sadly, he's no longer with us due to unfortunately, a different cancer diagnosis. So you could say that cancer prevention, treatment, and diagnosis is something that's very close to my heart, as I think it is for everyone in this room. Alberta Health Services has published guidelines for best practices, not breast practices, that's a different event, that are best practice for screening, detection, and treatment of prostate cancer, including serum PSA screening tests. And many of you are probably aware that serum PSA screening increases the detection rate for early stage, clinically significant prostate cancers. And healthy men between the ages of 50 and 75 years old should be made aware of the availability of PSA detection for prostate cancer and to talk to their family physician about this and other screening. And as folks who've been through this experience, I have a favor to ask. When you go home to your communities and as you're moving through your lives, please do spread the word to other men that you know about the importance of these screening tests and the early detection and diagnosis. In terms of Alberta's overall cancer rates, as our province's population continues to grow, and as some of that population continues to age, the number of new cancer cases is on the rise, with nearly 1 in 2 Albertans expected to develop cancer in their lifetime. To put that into perspective, each day, 49 Albertans learn that they have cancer. And over the coming 12 years, so by 2030, that number is expected to increase to 79 Albertans per day. So we have a lot of work to do. Because of investments in cancer control, including prevention, early detection, and treatment, the overall cancer survival rate has increased from 25% in the 1940s to about 60% today. And we want that number to continue to increase so that more Albertans are able to survive their cancers. Thanks to increased prevention and screening efforts, new treatments, technology, and research, more people are diagnosed earlier, entering treatment sooner, and living longer. But again, we know there's more work to be done, which is why we're focused on supporting new infrastructure, treatment options, prevention, and research to help reduce the risk of cancer and to support patients who are facing a cancer diagnosis and their families who support them. I am so proud of the work that we're doing on the Calgary Cancer Centre, a $1.4 billion investment to make sure that we have the state-of-the-art facilities to meet Albertans' cancer care needs. The Calgary Cancer Centre will deliver innovative research and world-class cancer care for patients from across Alberta and across southern Alberta. Patients from Calgary and across southern Alberta. And I was at the Foothills campus not long ago. Radiation vaults take a long time to build, so there's not as much obvious progress, but I have been assured that we are well on track to open in 2023. And it will be a beautiful building that will offer so many important services. But we also know that in the meantime, it's important to keep meeting the needs of people, which is why we've expanded hours for certain treatments at both the Tom Baker and the Cross Cancer Centre. We also have the Alberta Cancer Prevention Legacy Fund investments, which are aimed at developing a range of prevention programs and innovative research. To support research projects and initiatives aligned with wellness, prevention, and screening, government allocates approximately $25 million from the Legacy Fund each and every year. Through this funding, Alberta Health Services is leading multiple cancer prevention projects, including health promotion services focused on reducing cancer risk, comprehensive cancer prevention and screening programs with targeted approaches for Indigenous populations, workplace cancer prevention, tobacco reduction, community assessment tools, including the Community Cancer Prevention and Screening Dashboard, and the website albertapreventscancer.ca. Another research project that's supported by the Legacy Fund includes the Alberta's Tomorrow Project, which is a really innovative program that studies 55,000 Albertan men and women and gathers health data, blood samples, and records those and keeps them available for researchers for not just projects now, but into the future, so that we can learn a little bit more about how individual lifestyle choices, behavior, genetics, and the like can increase one's likelihood of getting cancer or help prevent cancer. Earlier this year, I had the opportunity to tour the facility and kind of get walked through what the process was for the volunteers who have contributed to the study. Literally blood, sweat, and tears from the volunteers. And hear a little bit about some of the work. And one of the things that was really fascinating while I was there was I met a woman who had signed on to the project. And about 2 years, she signed on because she thought she was very healthy. She took very good care of herself and thought she'd be a good sample for how to avoid cancer. Sadly, a couple of years after signing on to the project, she was diagnosed with cancer. And as we talked, she talked a little bit about how she was like, wondered if maybe that had jinxed her a little bit. But, she's going through her treatment, and we were talking about how she feels even more committed to the project now that she has her cancer diagnosis, because she feels that she can be a really important sample and a really important piece of that puzzle for us all in what the impacts can be and what the different risk factors and where it all comes together. So I thought that was just really fascinating. The Tomorrow's Project has been partially funded from the Legacy Fund since 2010 at approximately $3 million per year. Another really cool project is the Alberta Cancer Exercise Program for cancer survivors, which perhaps some of you in this room are part of, which supports that community-based exercise participation for health promotion and secondary cancer prevention, which also receives $1 million annually from the Legacy Fund. And I have to say that I've had the opportunity to hear firsthand from survivors about the impact that this program has had, not just on their physical well-being, but also on their mental health. Since 2015, the Legacy Fund has also committed to allocate more than $1 million over 5 years to enhancing HPV, human papillomavirus vaccination, in First Nations populations across Alberta. And finally, in 2016, almost $700,000 was provided to study whether early intervention of palliative care for colorectal cancer patients produces better outcomes. So there's a lot of little pieces that we're working on to help give us a better picture. Another important piece is access to primary care physicians, which is critical to accessing and receiving appropriate cancer screening. 80% of physicians across Alberta are part of primary care networks, which provide a necessary point person to coordinate cancer screening. Primary care networks also specialize in those transitions of care, which allow a patient to move to specialized testing in a more coordinated way. It's also one of the ways that we're addressing some of the concerns my colleague had raised around expanding the variety of healthcare professionals available to Albertans through their family doctor's office, so that we're able to have that right care from the right practitioner at the right time. A little later today, you're also going to hear a little bit about conversations around mental health and the impact that has, particularly for people living with a chronic or terminal illness. In my role as Associate Minister of Health, mental health is a really big piece of the work that I do and of the portfolio that I work on. And I just want to say, and I'm sure you've heard it before if you have a diagnosis, but I want to say that there is support available for you as you move through your diagnosis and your treatment and aftercare, that this can be very challenging emotionally and mentally, both for the individuals living with cancer as well as for their family and loved ones and caregiver supports. So please do reach out for help. There are supports available. Whenever in doubt, please call HealthLink through 811 and ask to be connected to the mental health support line. It's available 24 hours a day, 7 days a week, and can connect you with local supports. There's also amazing peer support groups. There's a lot of data about the benefit of peer support group where survivors can talk with one another about their experiences. So please, if you haven't yet considered it, please do consider availing yourself of those services. So it's been a real pleasure kind of having this moment to highlight some of the work we're doing. And I want to thank each of you here for giving up part of your beautiful Saturday to come and listen to us, and as well as to learn about some of the other advances and changes. And also, I really want to thank you for your compassion and your efforts in caring for and supporting the health and well-being of other Albertans. And I really look forward to the questions and following discussion.
All right, thank you very much. So we have just a little over 30 minutes for the Q&A session. We have until 2:30 for this particular session. So what we'll try to do, we'll give each of our representatives an opportunity to address the question. Now, some of them may be directed at one of them specifically, so we'll endeavor to let that person have first crack at it. The others can weigh in if they so choose. So let's begin with our first question. Which is on the research side. And the question is, what is the government doing to try to coordinate research that's being done in Edmonton and is being done in Calgary? We'll let Brandy Payne answer first.
So with respect to the question of research, that's actually a really great question, because it often can seem like, research is being done at the U of A, research is being done at the U of C, and do these professionals talk to one another? How does that get work its way through the system? And I wanted to say that a lot of the research coordination is done through Alberta Health. And so when these studies are conducted, they're often sharing the information with our department. And then from there, we use a lot of that research to inform the policies, be it around what are current recommended guidelines, as well as treatments available, that sort of thing. So we have a number of panels and processes in place to review those things. Because at the end of the day, we want to make sure that Albertans have access to evidence-based and clinically best care. And so that sometimes can take a little while to get all those ducks in a row, as it were, but ultimately we want to know that when we're making decisions about what treatments are recommended, that we're doing it in partnership with both researchers, with the College of Physicians and Surgeons, as well as with other healthcare professionals.
All right. Any of you want to weigh in on that? Okay, we can move on to the next question. A couple of questions about PSA screening. And maybe we'll combine them here. This question says, PSA screening is not supported by AHS. Why is that? And further to that, another question here says, well, why can't patients pay for that PSA testing if that's something they want? And once again, maybe we'll let Brandy Payne respond first.
Yeah, thank you. So one of the concerns that exists with the research right now around PSA testing is around a high degree of false positives that can have so this is something I didn't know until yesterday when I heard from my department the answer to this question, because there's a lot of research going on in the healthcare profession these days. So ultimately, we want to make sure that as we're doing tests and guidelines, that we want to make sure that they're the ones that are going to make the most sense and are going to get the clearest picture. So we continue to study the research that is coming out around the efficacy of PSA testing, as well as for which populations it can be best. Because it's the interesting thing, and this is something we're seeing more and more from the genetic research that's being done, is that Ron and I might have the exact same condition, but because of my genes and because of his genes, the way that we experience that condition may be differently, and which medication is going to work well for us might be different between the two of us, even with every other factor being similar. And so for us, it's really important to keep that eye on on what the new research and the evolving research is, that we can make sure that each person is getting the best testing, the best treatment for themselves. And ultimately what I would say is that for anyone in the room or anyone you're talking to please talk to your family doctor about whether or not any particular screening test is an appropriate test for you, if that's the best test, knowing your various risk factors and the like. And so that's why it's so important to have those relationships with your family doctor.
Greg?
Yeah, thank you. I did exactly that. I did talk to my family doctor about PSA screening. He's of the belief that the evidence is not at a place that would tell him not to do it at this stage. I'm obviously not an expert in this area, but doing some preparation for this event, within less than 24 hours, I received 2 emails. One, an American study which said PSA screening and DREs are more beneficial than harmful. And less than 24 hours later, I found a Canadian study that said essentially the opposite. So my view is, clearly the jury's out. But I guess, if the established practice is look, I'd like to know. So if my PSA levels are elevated, I'd like to know that. And that puts us now on a course, on a path at least. So now we know, and if there's early detection, yes, I think we all need to be alive to the risk that this is going to lead to unnecessary interventions. But it doesn't mean you go from elevated PSA to immediate surgery. There's a long pathway that gets you along there, and I think as long as you're having a good open discussion with your physician and you're availing yourself of all the experts and expertise available, to me, I think more information is better than less.
Okay. David first, and then Tany.
Yeah, I just want to echo some of what Greg has said, and this is why being invited to these kinds of events is so important for politicians, because we learn much more, I think, from you than you're going to learn from us here, and that's why it's so important. I actually didn't realize that the PSA test isn't, until just now. I guess I'd like to know more about that the PSA test isn't funded by Alberta Health. I thought a doctor would have the opportunity to order that if they, in their discretion, if they felt that was necessary. As Greg's alluded to or indicated, I also received several emails from different experts or people interested in this field, and some of them expressing concern about PSA testing and about early screening and invasive procedures or other ways of detecting prostate cancer. So I know that there is some controversy out there. I'm committed to learning more about it, and so this is why these things are so important. But I think generally we want to have as much information as we can personally as patients, and we hope that our physicians are well educated in what's necessary and what are the best tests that can be performed to make sure that we can early detect and treat all the types of diseases that we're confronted with over our lifetime. So,
And Tany?
Just want to say that not opposed to prostate-specific antigen testing, but certainly there is a risk with any invasive procedure. I think in the end, what we have to recognize is that there are many tests available, and that these are all tools in the toolkit that our health professionals require depending on your situation. So it is a case-by-case scenario. I mean, there's everything from general histories to biopsies to ultrasounds, blood tests, MRIs, bone scans. There's a whole bunch of different testing available for prostate issues. So certainly we have to look at all those when we're looking at a patient and trying to come up with the best solution for that individual person. And there's certainly some people that might fit the requirements that we may have to do a PSA test, and I don't think I'd be opposed to that.
Okay. This next question is an interesting one, and this actually it comes up fairly often, and from what I found doing what I do on the radios, people have some strong views on this. It's not necessarily specific to cancer patients and their families, but I think it certainly affects them and those who have to go for ongoing treatment and their families who are there to support them. The question of paying for parking at hospitals and healthcare facilities, and finding that balance between the needed cost of maintaining these parking facilities and it not being a barrier to accessing healthcare. So, Associate Minister, let's put that to you first once again here.
They didn't warn me that this was going to be the hot seat today. No, I really do empathize with the concern that I've heard from so many patients and their families around the need to pay for parking when you come to the hospital. And I wanted to make sure that everyone in this room was aware that there is a compassionate parking program available through AHS where your parking fees can be waived or with reduced monthly fees. So please do connect with Alberta Health Services about that if the parking is a barrier for you. At the end of the day, the reason that the paid parking exists is that the parking lots have to either be maintained by Alberta Health Services through funding that's given to run the healthcare system, or it has to be maintained through user fees. And ultimately, particularly with the rising demands for healthcare and with increased and growing population, I would really struggle with directing funds from patient care away from testing and diagnosis, away from frontline care, to pay to improve a parking lot or maintain a parking lot. And that's one of those, we sometimes talk about difficult decisions in government, and ultimately that is a really difficult decision. But ultimately, I believe that healthcare dollars should go to the provision of healthcare.
All right, then Greg, go ahead. Yep.
Actually, I'm going to take this as an opportunity. Brian Jean's here, and I had the real pleasure and honor of serving with Brian in the Legislative Assembly of Alberta, and I know this is an issue that Brian's been banging the drum on for a long time. But I want to take mostly this time, I just want to acknowledge, Brian, all the contributions you've made to our province, and I know we're not in the same party, but Brian's a remarkable guy. And so I know. And yes, I stole Tany's thunder. Sorry about that. But no, and look, I mean, I don't know the specifics of the economics on parking, but I think Brian's proposal is 2 hours free. It seems reasonable. I don't know what that would. I'm fairly confident in a $21.6 billion budget that probably won't break the bank. But I look at those. I look at it as a barrier to access. And I think there's, especially for people who are going through either treatment themselves or their families coming to visit and lift your spirits, it feels like a reasonable thing to push for.
Okay, Tany and then David.
Yes, I echo the sentiments of my Alberta Party patriot here. This isn't unusual for other parties to steal talking points from the United Conservative Party, by the way. And I was going to actually reiterate that, especially seeing Mr. Jean here about his concept behind the first couple hours being free. So I guess in the scheme of things, though, it is sad that our health institutions are forced to raise money through paid parking. Certainly there are other aspects. Some hospitals do it to discourage people from parking there because they park there, then they leave, and they use that as their commuting site. Certainly I've heard that. But certainly it's about allowing each health institution to manage their uniqueness individually. And but again, I also echo our associate health minister in saying that ideally we want any funds allocated to a particular institution to be focused on their health.
All right, David?
Yeah, I just want to add also that there's other factors we have to consider too, is where these hospitals are in their community. I grew up in Northwest Calgary and most of my family is there, so I've attended at the Foothills Hospital a lot over my lifetime, and there's areas around the hospital where you can get away with parking for 1 hour or 2 hours, but that can really put a lot of stress on the nearby communities if there's not enough free or lower cost parking near the hospital. So we also have to consider the neighbors to the hospitals too. And sometimes you go through those communities and they're just chock full of people parking and walking to the hospital. So I want to flag that too, and that's another issue that can be addressed with lowering parking fees.
Okay. So next question is specific to the UCP, so we'll let Tany answer first, and the others who want to weigh in on the question. It reads, I have heard that the UCP is considering a user pay approach to certain aspects of the healthcare system. Please explain what user pay principles are being considered and whether that's part of the UCP's approach to healthcare.
From my understanding, a policy that was passed was that universal access to quality and publicly funded healthcare was the main point of our healthcare policy. So again, we're quite consistent with all other Albertans in the fact that we do have a health system that we've invested a lot of money in, and we struggle with the reason as to why it isn't as efficient or as effective as we hope it to be. So certainly we'd be looking in the system itself to try to identify efficiencies, considering that we are spending a lot more per capita for our health than other jurisdictions. But then we have to recognize that the wait times in our province are really poor. 3/4 of people wait 10 months for hip surgery across our province. Cataract surgeries are at 9 months, a wait time for that sort of thing. Any musculoskeletal, like the hips, like the pelvis, anything else, legs, back, those kind of issues, the longer people are on those ailments, they're on painkillers for extended period of times. And now we're trying to address the issues of them that become addicted to opioids and other things like that. So it is a complex issue. If we had to consider contractors to try to alleviate those concerns, I wouldn't be opposed to that.
Hey, Greg, go ahead.
So the Alberta Party are strong advocates of our public health care system, and that should not mean that if you have more money, you jump the queue over somebody else. That's the fundamental essence of our healthcare system. Having said that, I think healthcare should focus on core areas. I think that you look at things like laundry services. There's no reason for that to be an in-house service. There are companies that do laundry services professionally and can do so at a high level of quality at lower cost. Laboratory services. The government, as this government came in, canceled an outsourced lab agreement to the cost of tens of millions of dollars and breaking the contract with the outsourced lab to do an in-house government-first kind of model. And those are the sorts of decisions that get made from a certain, I guess, ideological view of the world that I think don't. We talk about parking. I mean, that's just absolute pennies compared to these sorts of investments, these hundreds of millions or billions of dollars worth of investment. And I can tell you the government lab project that is happening up at Edmonton is millions and millions of dollars over budget. These are the sorts of things that the private sector is very capable of doing in an efficient, effective way that allow us to allocate those scarce resources to patient care, that don't mean we have to go down a path where there's any sort of a queue jumping opportunity, those sorts of things. Seniors housing, partnering with not-for-profit and faith communities to build seniors housing and not having the government do it 100%. Those are the kinds of things that we can have lower cost, high quality, faster builds in a way that partners with community as opposed to has a government first kind of model. So, that is, I guess, I could go on for a long time. I guess I'll let David. So anyway, hopefully that gives you a flavor of where we're coming from with the Alberta Party.
All right, David, and then Brandy.
Yeah, we really have to look at efficiencies and how we can best deploy our healthcare dollars. We haven't discussed the fact that here in Alberta we spend the most per capita on healthcare of, I believe, any province and almost all the territories, and we have the youngest population. So we're somehow spending more money per capita than pretty well anywhere else in Canada, and we should with a younger population. So there's some kind of a disconnect there. But Alberta Liberals, we're against user fees, and we were supportive of phasing out and getting rid of that annual payment or that monthly Medicare fee that we had in place in Alberta before. It's really important that we not create extra barriers to the healthcare system, especially for lower income people, and user fees or insurance payments, monthly insurance payments being instituted is really a regressive way of raising money to pay for our healthcare system. So I really want to flag that that's not something that we would support because it really disproportionately affects people at the lower income bracket. And I also want to reiterate some of what Greg has said about core versus non-core services. We came out quite strongly against that centralization of the laundry services and building some huge central infrastructure to deal with all the laundry requirements of the hospitals across the province, because we really felt that was sort of a big government approach to something that didn't need to be under the auspices of Alberta Health and not the best way of spending our money. So we have to look carefully at what we spend it on and make sure we're spending it in the most important places, but also ensure that we're not creating regressive barriers to the healthcare system for all Albertans.
So one of the first things that we did when we formed government was to cancel the proposed healthcare waiting room tax that was proposed by the previous government, which is now part of the UCP and some of your Alberta Party too, I think. Huh? So we think that healthcare should be universally accessible to all Albertans, regardless of how much money you make or how deep your pockets are. So for us, getting rid of the regressive healthcare premium that had been proposed by the previous government was a key and really important thing. My colleagues talked about a number of things, but I will maybe talk mostly about wait times, because I think that's one that's top of mind for a lot of people, particularly for those of you with a cancer diagnosis or loved ones with cancer diagnoses. And ultimately, we know that, making sure that people have access to treatment, whether that's surgery or other treatments, as quickly as possible is really critical. The time on a wait time and on a wait list can be very stressful and can lead to further complications. So we have been looking at a number of ways that we can do that, and there's been a number of really great success stories. We also have the shortest wait times across Canada for quite a number of surgeries and programs, and we're looking at those and what's been done in those areas to make sure, to help people get access to that treatment so that it's things we can replicate. One instance is for gastrointestinal specialists. Some work was done out of the Foothills Hospital and the researchers there, which took the wait list for specialists down from over 1,200 people to 21. It was a 92% reduction in the wait list over the space of a year. And when I first heard that number, I was astonished. I did not understand how that could happen and how those people still received the health care that they needed. But it turns out that it was about thinking about the system differently. And it was about having specialists connect with family doctors and be available for family doctors so that more of that screening and treatment for certain levels of the condition could be done out of a family's doctor's office with the support of the specialist, rather than you getting a referral to the specialist, waiting to see the specialist, and then the specialist being like, we could have done this out of your doctor's office. They've instead created it's called Specialist Link, a program where the specialists are available to review case files with the family doctors. And as they studied that program, they also found that the same number of people that the healthcare outcomes for all of the people that were on the wait list, who were then being seen by their family doctors and treated by their family doctors, that their health outcomes would have been just the same as if they'd been referred to the specialist and seen the specialist. So I would agree with the comment that we need to make sure that we've got appropriate healthcare services. And that's really about looking beyond the way that we've always done things to see ways that we can do innovative things. And ultimately, we're looking at how something like that can be replicated. We also put in an extra $40 million in this year's budget to address the backlog of some surgeries, including cancer surgeries. And we're working closely with AHS to make sure that those dollars go as far as they can. We know that's not going to solve the problem, and we know that sometimes the folks sitting at the table with me will say things like, you can't just buy your way out of the problem. Throwing money at it's not the solution. But ultimately, we do know that it does take money to operate ORs, to have the staff there, to expand access to treatment. There are costs associated with running the healthcare, and so we want to make sure that we're using those dollars in the best way. And as folks said, making sure that we're deploying those resources as best we can to meet the needs of Albertans.
All right. And Tany, you wanted to respond?
Yes, please. Thank you very much. Before we consider looking outside of our province in regards to bringing in health professionals to alleviate a lot of our concerns, we do have to remember that, and the government said it right, it's not about throwing money into the system. But currently, that is something that this government does. By 2022, we're going to have a $100 billion debt. We're going to be paying billions of dollars in interest payments. When we're looking at AHS, which is the fourth largest institution in our nation, some questions that I have asked the government and some things that we would be looking at doing is trying to find out and ensure that frontline services are supported. Certainly when Alberta Health has grown from 90,000 to 100,000 employees over the last 7 years, and I did ask the government the question what those positions were for. They could identify 1,500 of those jobs as frontline services out of 10,000. I asked her again the other day, same question. She couldn't answer it. And since then, Alberta Health under this government has grown by another 8,000 employees. Again, the same questions are asked about how much of that goes towards frontline services, to which the government could not explain it, other than talking about a little bit of investment in midwives, a little bit of investment in nurse practitioners and paramedics. But at the heart of it all is a large bureaucracy. The Auditor General wrote writes strong words in his reports about the bureaucracy and the duplication of bureaucracy within Alberta Health and Alberta Health Services. Everything at the highest levels, everything from mental health to continuing care to infection prevention, all have duplication of the bureaucrats with none of the frontline workers. So certainly when we're looking at our health system, we do believe, the United Conservative Party does believe that there is a way of taking a look at our system, reevaluating that, and reallocating resources to ensure that those health professionals are providing frontline care to all of our Albertans. Thank you very much.
All right. I think David wanted to weigh in as well.
Yeah, just if we're going to get into the debate a little bit, I do want to flag that the solution isn't massive cuts to our healthcare system to address the deficit. As Alberta Liberals, we're very concerned with the deficit. We've been very critical with running these massive deficits. I think we have to look at the disparity we have between what we spend in our programs and what we bring in revenue. But as I said, I grew up here in Calgary, and my family and I lived through the massive cuts of the Progressive Conservatives under Ralph Klein in the 1990s. And the new leader of Mr. Yao's party Mr. Kenny has mused about 20% cuts to the healthcare budget, and without really explaining how that would affect us on the front lines. We've seen that movie before in this province, and it caused massive hangovers in infrastructure and problems in our healthcare system that we've been addressing for decades since now. So I just want to flag that the solution is not draconian cuts to our healthcare system that will just cause further problems in the future.
Okay, so let's get a quick response from Greg, and then a response from Brandy. We'll try to get some more questions in as well here. Greg, go ahead.
It's starting to sound like the legislature in here. This is fun. I've heard a few of these things before. So, look, to be very, very clear, healthcare premiums are not part of the Alberta Party's policy. And the Auditor General, oh, sorry, can you hear me now? There we go. Healthcare premiums are not Alberta Party policy, to be very clear. The Auditor General did a remarkable thing a little less than a year ago. When he issues reports into certain departments, he will make recommendations, and he'll make new recommendations, and then he'll suggest, or he'll look at previous recommendations that have not been implemented and repeat them again. Instead of doing that this time in healthcare, he did a special report on healthcare, and he just restated the 41 outstanding recommendations to improve Alberta's healthcare system that the government has not acted on. So we know the answers to addressing the challenges in healthcare. We know the answers to making sure we get good value for money and making sure that we can continue to provide high levels of care and improve levels of care, reduce wait times. And what that involves is breaking down silos, is thinking differently about the system. And the example that the minister gave is a good one. There are examples like that in the system, and there are very, very good people who all too often are not allowed to innovate because that's not the way we do things around here. You know, well, there's no budget line item that allows us to do that, and we need all this permission, this, that, and of course it can't just be chaos, and we can't all just be doing our own thing. But things like strategic clinical networks, there was a question earlier about research and coordination, Calgary, Edmonton, those sorts of things. There's a lot, bone and joint, there's a lot of great work going on there. But what we often find is an innovative and slightly rebellious individual or group will kind of create this little skunk works off to the side, and they'll carve out a little budget, and they'll do it kind of half authorized and half not, and because they know that there's a better way of doing it, and they're kind of chafing against this giant bureaucracy system, and I think we need to find a way of not shuttling that off into a corner basement where we didn't think we were using it. We actually need to find those folks and celebrate them and elevate them up and point to them and say, this is what we need to be doing. That's actually beyond just healthcare, who we are as Albertans. We're entrepreneurial, we're innovative. We don't take no for an answer. We do stuff in this province, and I'd like to see more of that culture and that attitude in healthcare, and that's going to allow us to get more for the budget we already have.
Okay, and Brandy?
So many things that I could say, but I think what I will say is there's a really distinct role that Alberta Health and Alberta Health Services play, and so I'm not going to get into the bureaucracy because boring unless you're a policy nerd like me. But I mean, ultimately, the role of Alberta Health and the people who work there is to set kind of the policy and the direction, whereas Alberta Health Services and partners like Covenant Health and many others are the ones that deliver the frontline care. So there's actually two different roles there, and that, I guess, it might be misconstrued as duplication. The other thing I would say is that, you know, there's a lot of people that go into the healthcare system and that are involved in our healthcare system. Those of us who've had experience with the healthcare system will probably know our nurse, maybe our healthcare aide, our doctor. If we have a specialist, we'll be familiar with them and the folks who work in their office. But to be clear, the healthcare system supports all of those people, plus the people behind the scenes, cleaning up, dealing with the laundry, whether that's putting in the bins to be picked up or whether that's shipping it off and getting it cleaned themselves, whether that's the folks working in the kitchen, all of that. Also the people in the accounting departments and the human resources, making sure that those doctors that you're seeing and the specialists have the most up-to-date training and know the most current information about the research that's coming out. It also goes to support the research. And to be frank, the work that was done around that gastrointestinal program that I was telling you about earlier, that was mainly done by researchers and specialists, not by frontline service providers. So I just want to take a moment to say that while I think our nurses and our other frontline healthcare practitioners are amazing humans that we are so grateful to have working in the system, I think it's important to recognize there's a lot of people that help keep our healthcare system among the best in the world. There's absolutely room for improvement, and I think sometimes that involves that looking at it differently, seeing how we can use the resources we already have in a way that's more effective and helps get people to a timely and accurate diagnosis and access to the treatment they need. But I think it's also important to remember that these things do take time. And I think that one of our blessings in Alberta, frankly, is the fact that we have one healthcare service, that we're able to have that coordination across the province, and we don't have Edmonton region fighting Calgary region for resources because we know that there's a province-wide plan for it, and I think that that's kind of cool. And as a result, we have one of the 5th largest employers in the country, and interestingly, all of the others are banks.
Okay. Listen, we just got a few minutes left, so maybe we'll run down the table. We have 3 questions here, but I want to try to combine them because they all speak to the question of approving certain funding, or rather approving and funding certain drugs and treatments and the process that we need to have to make sure people can get the treatment they need. This question points out that Alberta is the only province that does not fund 2 prostate cancer drugs, Zometa and denosumab, I believe. Along the same lines, this question wonders why radium-223 is not available for treatment of prostate cancer. It is available in BC and Ontario. And third question, wondering if medicinal cannabis can be a part of treatment for cancer patients. So maybe we'll start with the Associate Minister, and then we can run down the table.
Thank you. So I'm going to say 2 separate things. The first is that all of the decisions for Alberta around what is funded and isn't is done through a pharmaceutical review panel. I don't believe that's the technical title because bureaucrats like to put lots of words in things. But they review the existing evidence for particular drugs and then decide from there whether it should be added to the Alberta formulary. Certain drugs that are particularly newer are sometimes it can take much longer than people who are living with a particular illness would like to see for the approval process, but there is a process that relies on the advice of experts because our government doesn't think it's appropriate for politicians to be making those decisions. Our host listed a number of drugs that I've never heard of before in my life. So I have to apologize. Prostate cancer isn't something that I'm not as familiar with it as other pieces. And so where those particular drugs are in the process, I would have to get your information and follow up with you about that. Alyssa, can I get you to stand up and wave to all the people for a second? Alyssa over there works in my office in Edmonton. So if you were the person who wrote that question, if you wouldn't mind approaching Alyssa, and we'll get your contact information, and we'll be able to follow up with you about those particular medications. I do know that different provinces sometimes do add things in differently, and that there is sometimes provisions for particular medications. So I would have to follow up with you
Okay.
on those particular ones.
Okay, David?
Yeah, well, yeah, I'm not a medical doctor either, so I can't speak to those particular drugs. But as I and others have discussed, there is that, obviously, that tension between how much money we spend on drugs and what the benefit is, and we always have to make public health or public policy decisions on whether funding some very expensive or experimental drugs. Not to say that those are, because I don't know about them, but we always have to have those hard decisions about whether we fund an expensive or experimental drug, and does that take money out of the system that we that could be funding treatments that are much more much better ability to actually improve the health outcomes. And then the other question was medical cannabis, and I'm actually this is a bit more front of line because a friend of mine, because Dr. Swan, our MLA, had a cannabis town hall a few weeks ago in Calgary, and I actually learned quite a bit from the panelists that we had. So I know that there's a lot of hype around cannabis and its health effects, and in many jurisdictions it's been legalized for medical uses. But there's still not a lot we really know, and what I learned at that cannabis town hall is the reason is because it's been criminalized for so long, and in places like the UK, and it's been very high up on the list of classed in the same class as heroin, for example, so a very hard drug. So we just don't have the studies, and for a long time scientists were really prohibited from actually studying the effects of marijuana and cannabis and its medical effects. So one of the benefits of the legalization of marijuana in Canada is going to be not only the federal government is funding a lot of new research into the health effects of it, but the scientific community is going to be able to really very closely study this drug and really provide some better information as to what it really does, whether it really provides the health benefits that so many are claiming right now. There's so much buzz around it that we really have to be careful to not get on the bandwagon and just think that it can cure everything. But I think that there's a lot of new information that we're going to be getting in the next few years.
Okay. And Greg?
I'm a real evidence-based kind of guy, and so, you know, and any time I hear Alberta is the only province that does or doesn't do something, my radar goes off, and I'm very curious why that is. So if we're the only province that isn't funding a couple of these drugs, why the heck is that? And then I'd like to know what the evidence is out of those other provinces or other studies globally that tells us what the costs and benefits of that particular therapy might be. And those benefits, I think, need to be measured not just in terms of financial outcome, but in terms of quality of life, in terms of longevity, in terms of health outcomes. And sure, those could have, I suppose, a financial component in terms of you're able to go back to work, and that may be part of it. But I think that we need to not just do cost-benefit in terms of pure dollars and cents. You know, same thing with cannabis. We are early days, I think, in terms of some of the evidence, although that body of evidence is growing. And I am probably the least qualified person in this entire room to comment on that. I have a political science degree. There's people in this room who have real science degrees who will be able to tell you a lot more about that than I can. And same thing with I think it was a radioactive isotope. I assume that's what it is. Where BC and Ontario are funding it, well, that's roughly half the population. So that makes me wonder, again, what evidence is being generated by BC and Ontario that caused, and what evidence did they use to choose to fund these particular drugs or these particular therapies that Alberta is either taking a different view of? What is that view? Why? And so just in closing, I'd say that the transparency around these decisions is as important as what the decisions are. How do we know? And that's a big job for us in opposition, to have access to that information. Sometimes we do, sometimes we don't. And that's another aspect that we always need to be thinking about. Thank you.
And last word to Tany.
As as opposition health critic and actually as an MLA, as the rest of my associates can account for, we all receive all sorts of requests and concerns about drugs that are not approved, pharmaceutical adjuncts and whatnot for various disease processes. And I think as Albertans and Canadians, we can rest assured that we do have systems that the Associate Minister of Health can certainly attest to, that there's professional subject matter experts behind the scenes who are evaluating all these things. From a certain perspective, though, there does seem to be a disconnect between our provinces and the federal government when it comes to approving a lot of pharmaceuticals and the adjuncts. So I'd like to see more cooperation and coordination between all of these agencies so that we are more consistent, because it would be interesting to know why a drug is approved in one province but not another. Rob, can I address one of the other comments made earlier?
Well, quickly. We are over time, by the way.
Oh, I just want, there's a misnomer that the United Conservative Party is going to cut health by 20%, and that is just an outrageous, complete lie. Just so you know that Jason Kenney was expressing concerns that Alberta pays 20% more per capita than British Columbia for health. And if you look at all statistics, they have similar or better rates than we do in so many ways. And certainly it was just a questionable how can they get their healthcare standards for 20% cheaper? But that's where politicians will spin that 20% number and throw it to other things. So
Okay.
I just want to clarify that for everybody.
Tany, thanks for that. As mentioned, we are over time here. Thank you all for your questions. I want to thank our panelists here today, Brandy Payne, David Kahn, Greg Clark, and Tany Yao. Thanks again to Prostate Calgary and the Prostate Cancer Canada Network Calgary for organizing this event, including me as a part of it. Enjoy the rest of your afternoon, and thanks again for being a part of this session.